Welcome to Dr. Joe Unplugged. This podcast contains general information and is not in any way medical advice. Teen vaping hits 10-year low in the United States. Goodness me, what have they done? Have they banned vaping? Have they stopped smokers from using the most effective and popular quit smoking method from doing so? No, they haven't. The contrast between Australia and virtually the rest of the free world is remarkably stark. We've spoken about vaping before, and listeners will be familiar that I am the chairman of Australian Tobacco Harm Reduction Association, which is a not-for-profit organisation. It receives no money from cigarette companies. Certainly doesn't receive any tobacco excise money, which the government does. In fact, tobacco excise is about the fourth single biggest line item in the federal budget. And none of that money from tobacco excise flows to me or to ATRA. It does flow to health departments, surprise, surprise, and to a lot of academics as well. This is from MedPage today, and as always, we'll put the link in the description below. Fewer adolescents are vaping this year than at any point in the last decade, government officials reported, pointing to a shrinking number of high school students doing so. Latest survey numbers published in Morbidity and Mortality Weekly show that teen vaping rates fell to under 6%, down from 7.7% in 2023. So teens are still vaping. And I suspect some of them are drinking, some of them are smoking, some of them are using illicit substances, some may be having underage sex. We don't want any of this. But when I last checked, and I suspect for most of you out there, when any of you last checked, it's not a perfect world, and that we don't want people to perform particular acts or tasks or use certain substances doesn't mean that they might not do it. I mean, the war on drugs was declared in 1971. That's 53 years ago. If it had been even a vague success, we wouldn't be seeing the problems that we see now, and in particular in the United States, the issues they have with fentanyl and fentanyl coming in across the southern border. And I make no comment on the workings of the border there, but one cannot dispute, and it doesn't matter what side of politics you're on, you cannot dispute that there's a lot of fentanyl coming into the country, and it is now taken over from oxycodone as the biggest single problem drug in the United States. And I was actually told yesterday, and this was a concern to me, and it was not something I'd heard previously, that we are starting to see fentanyl seeping more into the Australian market as well. And I was told, and it unfortunately doesn't really surprise me, that the epicentre of this is Melbourne. Melbourne is also the epicentre for fire bombings of tobacconists and corner stores as the organised crime gangs fight for market share in both the illegal tobacco and the illegal vape market. Why are there such big markets for vapes and cigarettes illicitly? Cigarettes you can buy at any corner store. Yes, you need photo ID to prove that you're over 18, but other than that, you can buy them at supermarkets, at petrol stations, at convenience stores. It's not difficult to get hold of cigarettes. But they're very expensive. Most of that expense is taxation. And to circle back to where we start, we have a government that is addicted to taxation revenue, and we have a lot of hangers-oners, for want of a better term, who also are very addicted to that flow of revenue. When it gets too expensive, people look for alternatives, and they look to the black market. And the amount of illegal cigarettes now in Australia is significant. I don't have exact figures at my fingertips, and surprise, surprise, they're difficult to get hold of, and the people who could get hold of them, which are government authorities, are not really going to want to release them. Why don't they want to release them? Well, it shows that their policies are a failure. Vapes, as of October 1, can be purchased at pharmacies without a prescription, although a number of pharmacies have said they don't want to stock them, and I get it. It's not their business. Why should they? I mean, they should be, and the reason to do it is because the government have told them to do it, but the pharmacy guilds typically don't obey the government always, and they're not obliged to, which is an important point as well. I suspect some pharmacies will stock it. Some will see the opportunity to cater to those who actually want to give up smoking. But I get back to, and we have spoken about this before, Australia's unique and outlier position when it comes to vaping. For people who don't smoke, They shouldn't be taking up vaping, and that's at any age, including teens. And teens shouldn't be taking up cigarettes and a whole lot of other substances, as we've touched on previously. The UK government and others have demonstrated, and the UK government has done this work three times, that vaping is at least 95% less harmful than smoking. It's not harmless. The best substance for your lungs is fresh air. Fresh air. But it's at least 95% less harmful than smoking. We know from work that's been done that it's the most popular and effective stop smoking method. Now, there are a number of other stop smoking methods, and that includes patches and gums and sprays, and the gums and sprays in particular come in all sorts of flavours, which the government feels is a problem with vapes. But it's not a problem with these other forms of nicotine. And nicotine can be purchased at the supermarket, as I mentioned, in these patches and gums and sprays. And it's even on special sometimes. But put nicotine into a liquid and suddenly we have to ban it and make it very difficult for people to use. And we're already having anecdotes, and yes, they are anecdotes, but eventually it becomes data of people who are now finding it too hard to continue to vape. They have successfully given up smoking. And now they're taking it up again. I mean, what an absolute failure of policy. And all of this is done on the moral panic of teens vaping. Now, we've seen in America an increase in teen vaping, and we are now seeing, as always happen, they move on to the next thing and rates are declining. And rates are declining without having to sacrifice the lives of smokers who are wanting to quit but haven't been able to. The idea of being able to walk and chew gum does come from America, but essentially it says you can do two things at once. Can you support people who want to quit smoking and improve their health, and at the same time, as best you can, protect teens from taking up vaping, and this applies to other substances as well? Yeah, we can do that. We have a liquor licensing system where liquor and alcohol is not sold to people under 18. And people who are over 18 can drink. Some drink too much. Most drink responsibly. Some teens will get access to alcohol. It's not perfect, but the system works. The system for vaping also works in New Zealand, in the UK, in the EU, in Japan, in the USA, in Canada. The list goes on. And all of these countries are able to have falling rates of cigarette smoking and minimise access by teens. So if all of these other countries can manage it, why can't Australia? And we could. It's not that we lack the capability, it's that we lack the will, and we are blocked by ideologues who held tenured positions in academia and big public health and suckle on the government teat. And given the amount of money that flows from cigarettes to government, you can probably understand why. You can form your own conclusions, but I think you can understand why. What's the solution? Look, the solution is fairly simple. New Zealand has got this completely right, and their smoking rates have fallen precipitously and well overtaken Australia in terms of falling rates, and they have now fewer smokers than Australia. So does the UK. The USA is also close to Australia and falling faster. So in another few years' time, we're going to see even more that Australia is the laggard. And that's sad, because at some point we were the leader. Literally in the last century, but we were the leader at some point. It's not difficult. We don't need to reinvent wheels. All we need to do is adopt the same mechanism which is clearly working internationally in Australia. And yes, we want to minimise access to a whole host of substances by teens, but we also want to help people who continue to smoke and are wanting to quit, and as much, maybe more, but certainly as much, those who have successfully quit and are now facing having to take it up again.
Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please subscribe, like and share. You can also follow it on all the socials. There'll be new content uploaded each week.